Hello, my name is Kaylin Anders. I'm going to be the nurse inserting a NG tube today. So we do have a doctor's order for inserting an NG tube for suction because we do have like an obstruction in the stomach, so we need to get all the secretions out of there. So order for suction. So I just want to confirm your name and date of birth, sir, before we go ahead and get started with this. All right, perfect. Okay, so I'm gonna go ahead and wash my hands, do hand hygiene, and then put on my gloves. And I want to make sure that the patient is in high Fowler's. And he is, so that's great. All right, these are gonna die. All right, sir, so I'm gonna go ahead and explain the procedure to you. So basically what we're gonna do first is we're going to check your nostrils. So I'm just gonna do that real quick because we could do that real quick, no problem. So I'm gonna use this pen light and just look up there to see if there's any masses or anything, because I might want to choose a different nostril if there is some kind of growth or something in one of the nostrils. So I don't see anything right off the bat, so I'm gonna go ahead and just close one of the nostrils and have him breathe. You can go ahead and breathe, sir. Okay, and he's able to breathe through each nostril when I close them, so that is good. So I think I'm gonna go ahead and do the left one. I'm just choosing one. And if I do hit resistance, then I would pull out and put it into a different nostril. All right, so, sir, this might be a little bit uncomfortable or painful. And if it is at any time, please let me know. Just raise your hand and we'll just take a break. So I'm gonna go ahead and close the drape so that we're providing the patient with privacy. And then I'm gonna go ahead and put a towel over him. Okay, and I do have my tube soaking in some warm water for right now, but I am gonna take it out and I'm gonna measure it. So we know correct placement in the stomach. All right, so for measurement, you wanna start at the nostril, and then we're gonna go back to the earlobe, and then down to the xiphoid process. So I get about 35, and it's labeled on here, it's 35. So we're gonna go down until we hit 35. That's how we know that it should be in the stomach. All right, so I'm gonna go ahead and lube up this tube. All right, so I think we're about ready for insertion. Sir, so if you do start to gag or cough or throw up, I will give you some water that you can sip, and I will advance it 2 to 4 inches as he's sipping, so that will help the tube go down a little gentler for him. So, all right, so if you're ready, sir, just tell me if it gets uncomfortable. Okay, doing great job, good job. Okay, yep. It's coming out the front, sorry. Okay, so we're just pushing. He's doing great. If he does gag, I have my water right here just in case, so he can take sips. He's tolerating very well. Okay. All right, so I did get to 35. So perfect. I am going to tape this tube onto his nose. I kind of split the tape into 2 so that it kind of is very secure. So, okay, great. And I'm also going to take the safety pin and clip this tube onto his gown so that, you know, in the event that he is throwing up or something is happening, he's not ripping it out of his nose. So, perfect. All right. So, next I want to, and I did have this emesis basin just in case he was throwing up, but he tolerated very well, so we're good on that. But next per company policies, they would like us to check placement via aspirating up some stomach content and then putting it into a cup and testing it with a pH strip. So I'm gonna go ahead and connect it. Perfect. Okay, I'm just gonna draw up a little bit of stomach acid or stomach content. Okay. And then I'm gonna dump that into my cup. And I have my pH strip right here, so I'm gonna dump that in. All right, and so if the pH is between 1 or 5, that's how we know that we're in the stomach, and it's right at 3, so perfect. We are in the stomach. And if it wasn't in place, the company says that we can do a x-ray to follow up and make sure that it is in the correct place. All right, so now that that is all good, we want to hook up our NG tube to the suction apparatus because that is the point of the NG tube. So I have my suction over here. I'm gonna hook it up. Perfect. And then per company policy, they want us to check for tube patency. They want us to change the tube every 24 hours. And I'm just gonna be kind of monitoring the like drainage and what it looks like and how much is coming out of the tube. So I think that is it. I'm just gonna make sure the patient is comfortable, and I'm gonna set him back down out of high Fowler's. And Mr. Jones, you did very good. You tolerated the procedure very well. So I am all done with him. When I go back to my office, I will document that he did tolerate it well. I will be measuring the output of the secretions, what they look like, how much is coming out, and just that he tolerated the procedure really well. So I think that is it. I'm gonna go ahead and take off my gloves, go ahead and do hand hygiene, and we're all done. Thank you.